So I'm based out here in Uganda. It's coming up to 5 years now, and we're very small. We work with 4 partner schools in 2 districts, Jinja district, Bwikwe district, sort of eastern Uganda. They're kind of low-cost primary schools, and we work a lot on transforming the whole school environment. So we're sort of moving, we do construction, but we're moving a bit away from that and much more into capacity building of the school leaders and teacher training. And yeah, part of it is this mental health initiative. So we like to focus on the whole child. So it's thinking about their physical and their mental well-being as well. So it's in partnership with an organisation called You Belong, and they've got a team of experts, sort of social workers, psychiatric nurses. They really are specialised in mental health in Uganda in this setting. So we were so lucky to be able to partner with them. They focus on a lot of early intervention work, working closely with families and communities and with health facilities as well. So their skill set was just a perfect match. They also identified that they wanted to do more in education and in schools. So when we were feeling a bit lost on how to even start this off, so us meeting was really good timing. Sorry if you can hear background noise. So I just want to jump back a little bit. As you know, the pandemic really highlighted the issue of mental health. And when we were all locked down, probably about 2 or 3 months into the lockdown, we were communicating with some of the teachers on the phone, and just surveying them a bit and asking them like how prepared they felt for whenever we reopened to go back to school. And they identified a few issues, but in particular, they were very anxious about how the children would be mixing again after being shut in at home and various things happening to them, of course. But what they also highlighted is that it wasn't just going to be an issue for the children. It was also going to be an issue for themselves potentially. So they were saying it's not just about the kids, we also might want some help. So that kind of, it didn't exactly sow a seed. I guess the seed was already there. It kind of planted it a bit deeper and made it grow a bit more. And some of those things that they brought out, we were able to implement straight away, not related to mental health, but we just decided that we wanted to think about how we could start to help the children and the teachers when they got back to school. So I won't go into too much detail. We did do a few activities just to test things out, to give kids confidence, the ones that were about to take their exams, and to help them sort of recognize and label emotions and that kind of thing. It was sort of testing the water. Then we came across You Belong, and they came, it was probably, I think it was October 2022. They came and did some training with us. So we had a couple of representatives from each school, along with one or two of the school leaders. And they talked about how to recognize signs of mental distress and certain mental health issues and conditions, just to give, I suppose, a bit of a taster in a way, and to raise awareness. So fast forward another year, and by then we've put together a program. Mostly them, I have to say, we've sort of really benefited from their experience, but with our input. So we kind of kicked it off officially, if you want to call it that, in June last year. And in July, we did a sort of baselining exercise, a situation analysis, where we talked to various groups at the schools of parents or caregivers and teachers. And we also talked to some of the health workers at Jinja Referral Hospital, which is, I guess, the main referral hospital for anything, because it's got a mental health unit, which was actually turned into a COVID unit during the pandemic, but I think it's back to mental health again. And then a few other clinics around. So I thought it might be useful just to share a little bit from that. We've kind of got a long-ish report on it, but I just thought there were some useful findings that I could share. So I think because of the discussions that we'd had over the previous year, a lot of the teachers felt like they could identify signs of mental distress in the children. But what they didn't feel like is that they had any skills, or they just felt totally unequipped to actually deal with any of this. And what they also are quite anxious about in other aspects of their work as well is the ratio of learners to teachers. Obviously, if you're trying to look after a bunch of 80 small children, it's quite difficult to sort of spot certain issues and behaviours. So that was quite a worry for them. And of course, they brought up, I think, what we all know, that often signs of mental distress are totally misinterpreted as just bad behaviour. You're probably, or I know quite a lot of people are familiar with the term stubborn. Like, we use stubborn in a different way in the UK, but they often call the children who are just misbehaving, as they put it, or naughty, stubborn. There's also, of course, the stigma, which exists all over the world, but it's also particularly bad here. And it's something that we want to focus on breaking down over time, of course, with more awareness. But I suppose what I hadn't thought, I know that the stigma is likely to mean that the kids get bullied, or that they're isolated, or that they even isolate themselves. But of course, it does affect school attendance and enrolment. So it does cause a lot of school dropouts. So actually, something that I'd quite like to do is see if amongst any of this research, we can get figures on how many children do drop out of school as a result of this, or don't go to school at all in the first place. There was a not that surprising perception, I guess, that girls express themselves better than boys. I guess because of traditional roles, the girls are kind of allowed to cry and the boys aren't, or the girls are more likely to. Maybe that's not true amongst the small ones so much. But what they were also highlighting is that some of the traditional cultural perspectives can actually damage the well-being of the children, because the boys are told to man up, or little boys being told that they shouldn't cry and they should be a man. So they were feeling less able to express themselves. So I think also the teachers recognized that when kids did come to them with problems, they'd already spoken about it with their friends. So that really underlines how valuable it can be to have sort of peer-to-peer support in this kind of setting as well. Because quite often, maybe that by the time a teacher found out about a problem, the other children or some of the other children already knew. When we talked to the guys at the Jinja Referral Hospital, I think they said that once a week there's a kind of clinic for children presenting symptoms of mental health issues or distress, and they get 15 to 20 children showing up each time. So that those are just the people that are brave enough to go there. So it does indicate that it is quite a problem, of course. They also said that there is often a lack of skills amongst the health workers. And I think the health workers that are specialised often get pushed into general nursing maybe, or general other duties. So they can't necessarily dedicate themselves to the children that have got those issues, or the adults. There's also a lack of medication, not surprisingly. And some of the newer medication, I think there's some new medication for psychosis they just don't have any access to at all. So that's also a big problem. So there were some additional challenges, which I guess might be a bit more, not necessarily specific to Uganda, but certainly in the Ugandan context. It's quite interesting that the Ugandan government recognizes, doesn't actually recognize epilepsy as a sort of neurological disorder. It says it's a mental illness, which then kind of also perpetuates the fact that when people see somebody with epilepsy, they quite often think that they're possessed by demons. So there's a lot of belief in certain communities, of course, in witchcraft and ancestral spirits and that kind of thing. I don't think that's necessarily anything new. But what was new for me is that apparently some traditional healers, and we know that people do use them a lot, they sometimes buy the psychotic drugs, the antipsychotics, and they mix them with their own traditional medicines. So then they kind of get more credibility within the community, because of course, I guess if you are using some of the medication, then maybe you actually do see some results and some relief of some of the symptoms. So that was a new one on me. So some really interesting findings, some predictable, some not. And we have now sort of developed a plan for these 3 years. And I haven't been looking at the time at all, by the way, so I'll whiz through. But we basically did a workshop for a couple of days last week where we were helping people from the schools to think about materials that they can use to raise awareness and to deliver certain messages and stories about mental health. Could be a calendar, could be posters, that kind of thing. So we also want to do some more training on guidance and counselling. We want to have a couple of focal point people, or whatever you call them, champions within each school that are going to keep on pushing the agenda, and also help the children to set up some mental health clubs, because again, recognising that peer-to-peer support, we want the children to be able to come together and speak to each other confidentially without an adult around necessarily. We're going to be helping them with some sort of policies and structures as well. We've got our own safeguarding policy. We're looking at that, and we're thinking we could maybe help them develop their own policies for the school and do some training on that, and have mental health as a part of that. We want to increase caregiver involvement. That's in general. In general, we want the children to, the parents to have much more involvement in the education of their children. But they, of course, need to be involved in this, because otherwise the children talk about what they've done at school, run home, and the parents really don't understand why this has been brought up. I know that the CEO of You Belong doesn't even talk about mental health in children because it frightens people off. He just talks about the well-being of the children, or happy children, or whatever. So we have to really think about the language that we're using and changing some of the negative language as well around people with mental health issues. You see someone in the street, they usually get called mad if they are exhibiting signs of mental distress. What else? Very quickly, yeah, we also want to try and strengthen the referral system, so outside the school. So if there are children presenting problems or issues, potential issues, the schools know where to refer them, but also so that those referral centres are aware of what we're doing. So we want to build some of those relationships, and also just strengthen the school systems so that if there's maybe no criminal or safeguarding aspect involved, they know to refer children who are maybe showing signs of distress to those focal point people that I was talking about. So those are kind of some of the plans that we have. It will probably evolve a lot as we go along, and always very, very happy to get advice from others. So yeah, all I can say really is that it has created a lot of interest and a lot of support. People have called us brave for doing it, because we could potentially open up a lot of cans of worms, but I'm just very happy that we do feel like we have some structure to it now, and we feel like we are going to be making some inroads. So yeah, thank you very much for listening, and happy to answer questions, but would also like to open up some debate. And Marl, I'm sure you've got loads to say on this kind of thing. It's your expert area.
I will first open up the floor for any questions